Carrie Billy, President and CEO of the American Indian Higher Education Consortium, or AIHEC. And I'm going to start sharing my screen. Can you see it?
Yes.
Yeah, okay, great. Thank you all for being here this afternoon or this morning, whatever your time zone is. We appreciate it. On behalf of the nation's 37 tribal colleges and universities, which are AIHEC, and our wonderful partners, the National Native Health Research Network and the Indian Health Service, welcome to the fourth webinar in our 2020 National Native Health Research Training webinar series. The theme for our entire webinar series is the National Tribal Health Research Agenda, Governance, Trust, and Culture. This fourth webinar will specifically focus on traditional ecological knowledge and environmental health, two extremely timely topics today as we have wildfires raging in the West and a hurricane pounding our southern Gulf lands. So we're very excited about today's presentations. We at AIHEC like to start all of our meetings with a land acknowledgement, and usually our meetings are in person, but although we are located throughout this nation now and perhaps even beyond this nation, in the Alexandria, Virginia, Washington, D.C. area, I'm on the homelands of the Anacostan and Piscataway nations. And we honor their lives, their legacy, and the way they took care of the land and continue to take care of this particular land. And we recognize that this entire nation is now home to citizens of many diverse nations, but it is the homeland of many tribal nations. So before we start, we also want to just do a couple of housekeeping things. All the participants are muted now. But please, just in case something happens, please keep your phones, computers, microphones, anything muted as well. That'll just make things a little smoother. We're hoping to have time for questions after the presentations today. So if you have questions, the easiest way if you're watching on Zoom is to type your question into the chat box. You can type those questions in anytime as soon as you think of them. Maggie Grandin, who's on and kind of monitoring everything, will be monitoring that chat box, and so we'll be able to share those with the presenters at the appropriate time. Also, if you're not on Zoom, you can email questions to Maggie Grandin, which is mgrandin, M-G-R-A-N-D-O-N, at AIHEC, AIHEC.org. We're recording today's webinar, and after editing, the webinar will be available on the National Native Health Research Training Initiative website, www.nnhrti.org. So we hope people, please share that with people you know. Also, we are evaluating all of these webinars to try to make improvements, and it's really important to get your input. So we're going to have the Zoom-based webinar, our webinar evaluation at the end of today's presentations for everyone to participate in. So we ask you to hang around until the end, or we'll also be emailing it to people whose email addresses we have. Okay. Finally, if you have technical difficulties, be sure to reach out to Maggie Grandin. And again, that's M-G-R-A-N-D-O-N at AIHEC, AIHEC.org. And Maggie can help you with anything. Hopefully. Okay, we always at AIHEC, again, the tribal colleges, like to start all of our meetings in a good way, as I know many of you do. And so I am honored right now to introduce Dr. Elmer Guy, who's the president of Navajo Technical University in Crown Point, New Mexico. It's one of our top tribal colleges, and Dr. Guy is a wonderful, generous person. And so Dr. Guy, I'm gonna hand it over to you. Thank you so much for accepting our request that you open our session with a prayer today.
Thank you, Carrie. It's noontime here on Navajo. Thank you for this opportunity to do a little prayer for a wonderful seminar that you will have today. there's quite a few participants today. And in Navajo, we say, meaning that a challenge from our elders, from our parents, leaders. And that is basically telling the youngsters to learn something, bring something, a new knowledge, and some new tools, new medicine or whatever, is to learn and come back and help your people. And it sounds like that's what's going on today with some of the presenters, Karletta Chief, my bro, Yazzie, Dr. Cubano, others. So that's, I'm sure it might be similar to other cultures. It's where I think that's why we do what we do, is try to help our people. So if you'll bear with me, I'll be praying in Navajo. One. In the day, the net on a Sunday, at the shut I did now cost it in long. At the National Native Health Research Training webinar with Ya. Since Kiji by all tribal colleges or universities with Ya. I call home the large and hearts that Carrie Billy with Ya at the Nandlo. Genome you can't lot or yard urban he all cut now state and I don't that all tragido other istra the default semester. I don't that a yard out the house at all. I thought she hit a night or car. It long a yard abancy case. At all the change the ya is in home just to it in your time home. COVID-19 but it no hits other Zaren Dal Todol Ado Ea. Hit yet the horn there. Hits Ajo de Nossend or let in the name of Lady which needed to deals and leho. Ado I hear la the teacher a home, but Ado that Tiendo or is John de Leggy. Here la on it ask the GDA, but the old cado not on it than Leho. Hasn't so she in Genome getting the hot dog, on Genome get the tinkle yet, by only $10. But I want to resent the children yet has steed or little arrow, Sao to the nature, the whole Jish, November 3rd, go a honat on yet eggy. Not only has your yat el Nicadol was he, not only yat el not, I get up with the wheels. What that eggy, Genome, Nkadaway at all Genome, but that is Nishkitia, a part not that to little lago, that you on little on here, hidden there, since Kizidan, Lenny Ado, National Holzene, Geno a has your at Argy, they do little. But I hit your husband has cleaned all this. I think though shut at now costing long. Yeah. Hosoro little, Hoson Hasley, no little. Hoson Hasley. Thank you for this opportunity to share a short prayer with everyone and have a good day.
Thank you, President Guy. Thank you so much for your prayer, for your good opening words, and for all the help that you give us all the time. We really appreciate it. So thank you.
Welcome.
Okay, so we'll move on. Before I introduce our first panel, I wanted to just quickly go over the agenda for today's webinar. We have 3 different sessions within our webinar. So we'll start with our keynote presentation with Dr. Karletta Chief and Duane Yazzie, as President Guy mentioned, and they'll be talking about the social and cultural impacts on Diné communities after the King mine spill. So again, another important topic. And then we're going to turn to a panel presentation on some health research training opportunities that might be helpful to Native researchers, particularly newer younger Native researchers from the NIH and CDC's program on public health, the Public Health Associates program. So looking forward to that. And then we'll close with a second Native research presentation on wastewater-based epidemiology in tribal communities. And then again, as I said, we'll have our evaluation at the end. So I will introduce the presenters as we go through each panel. So again, thank you all panelists for being here today to discuss these important topics. Oops, I'm gonna go back one. I'm gonna go back a couple. Actually, I think I can probably stop sharing my screen because we're gonna turn to our next presenters. Our keynote presentation, as I said, is social and cultural impacts on Diné communities following the Gold King mine spill. And we have Dr. Karletta Chief, who is a citizen of the Navajo Nation and a first-generation college graduate. She's an associate professor and an extension specialist in the Department of Soil, Water, and Environmental Science at the University of Arizona. Her research focuses on improving the understanding, tools, and predictions of watershed hydrology and how natural and human disturbances affect soil hydrology. She also focuses on how climate change affects Indigenous communities. And as an extension specialist, Dr. Chief works to bring relevant science to Native communities in ways that are relevant to those communities and their cultures. Dr. Chief is the recipient of numerous well-deserved awards and honors. She's been named the ACES Most Promising Scientist Scholar, a Stanford University Distinguished Alumni Scholar, one of the Native American 40 under 40, and the Phoenix Indian Center Woman of the Year. So thrilled to have you with us today, Dr. Chief. And joining Dr. Chief is Duane Yazzie. Mr. Yazzie has served the Shiprock chapter of the Navajo Nation for 45 years, and he's currently the Shiprock chapter president. Chile's leadership was tested in August 2015 when a deluge of over 3 million gallons of contaminated mine wastewater threatened traditional Navajo agriculture communities along the San Juan River during the gold mine spill. A lifelong activist, Chile is concerned with the civil and human rights of all people, the attainment of true Indigenous sovereign status, environmental justice, the climate crisis, and the future of our grandchildren. So Mr. Yazzie, again, we're honored to have you with us today, and we look forward to your presentation, Dr. Chief and Mr. Yazzie. I'll turn it over to you.
Adon NHGRI authority national to the Bashishin as a planet that she chaded touching a national accord our a sanachle. Kadea Shima a Hatotzi. Thank you everyone here for listening from all parts of the world today. I am Bitterwater, born for near the water. My maternal grandfather is Mini Goats. My paternal grandfather is Red running into the water. And at this time, I would like to have my brother, Mr. Yazzie, start our presentation. AIHEC.
AIHEC certeza. Ado AIHEC kueta dainos aigi adet Senant Dr. Guy Elmer kuet citizen hayin AIHEC and sago. I would like to just express my appreciation and gratitude to participate in this presentation. I join in claiming all of the Western Hemisphere as indigenous lands. The topic here that refers to the cultural and social impacts that we suffered here in the Shiprock community, as well as other farming communities along the San Juan River, the damage that we suffered goes beyond the cultural and social aspects. It certainly also impacted us very greatly economically and spiritually. And we continue to be indebted to Dr. Karletta Chief and her team to help put into perspective the damages and that we suffered, in addition to the physical aspects of what took place in August 2018 or 15, excuse me. So with that brief comment, the presentation will go back to Dr. Chief. Thank you.
As my brother had stated, we have a diverse set of multidisciplinary investigators with expertise in social, environmental, and health sciences. And so because trust is really important to us in developing this project, we wanted to make sure that the community was the driver in developing the research questions and in collecting the data, analyzing the data, and reporting back the results to the community. And so I often co-present with our community partners, our tribal college students, and collaborators in various formats. So I want to acknowledge all the different individuals who have participated in making this project possible. The community was greatly impacted on August 5th when 3 million gallons of acid mine drainage was released from the Gold Key mine. And so just imagine turning on your water faucet in the morning and seeing yellow coming out of your faucet. If you can imagine the horror that you may experience, that is a little bit of an understanding of the shock that the Navajo people experienced when they saw their precious river turn yellow. And so the people were deeply traumatized, worried, and concerned because of this contamination. And so it was no light matter for them when this occurred. And so we were already working with the community, particularly Diné College, in learning modules related to arsenic. And so when this event occurred, we were asked by the Navajo Nation how we could assist. And so we went into the community and we held listening sessions to understand what the primary concerns were. And in this listening session, the community said they were very concerned about human exposure from the spill, not only to the people farming in this region, but also to their children, and also thinking into many generations ahead, and also to the ecosystem, the life that resides in the river, as well as the plants that sustain from the river. Because of what had happened on August 5th, 2015, there was an inadequate response, and it was difficult to estimate what the impact would be to the Navajo people, and particularly what would be the impacts to the corn, which is a sacred staple of the Navajo people. And many of the Navajo people use corn for not only growing for their livelihood, but also for many cultural and ceremonial purposes. The corn that is used is heirloom seeds and passed down through generations. So there was a very high risk perception and distrust. The Diné people's voice came through these listening sessions, and they said that they fear that the water is not safe. They didn't trust EPA and feared that the data would not come back to them. They were also frustrated in the decision-making protocols and they were concerned about the future impacts to the river. So after we received extensive approvals through the local government, as well as the Navajo Nation leadership and the Navajo IRB, we were able to do focus groups. And these focus groups were to try to understand what were these concerns of the Navajo people, how has their life changed as a result of the spill, and also to ask how was their life before the spill. And then they were asked into the future, what would they like to see? So the focus groups were held in the summer of 2016. So it was about 9 months after the spill. And we held 12 focus groups in Upper Fruitland, New Mexico, Shiprock, New Mexico, and Aneth, Utah. 124 participants were recruited. We recruited them through KTNN radio, KNDN radio, as well as posting flyers on chapter houses, working with the community health representatives to recruit. We also had a Facebook page where we posted the flyers. And so we had a good response to the focus group. We also had such a great response that some participants wanted to attend twice, but we just had to let them know that, you know, they just needed to participate once. So we had a really good turnout. So from this focus group information, we really tried to use a cultural approach to not only collecting the data, but also analyzing the data. In the focus group, we had a Navajo speaker lead the focus group, as well as a note taker that was Navajo. And that was important for us to ensure that we captured all the cultural components. We also, in the analysis stage, made sure we had a Navajo coder and a non-Navajo coder. We also did a consensus analysis where the transcript was coded twice. We really relied on our Navajo linguists to help us with the translations from Navajo to English to ensure that there was accuracy. We used the Diné concept of worldviews as a guide to analyze. This is coming from literature that was published about the Diné way of worldviews, and it comes from the directional aspect of looking at our day, months, life, seasons, everything. And so from the east is the start of the day, beginning of life, and that represents white spiritual wellness. As you move to the south, as you mature into young age, we start to think about economy and livelihood. And then we go to the west, which is adulthood, and you've gained your knowledge and grown, and you start to have a family and community. And then finally, as you end your day in the north and in your life, in your older age, you have a great amount of knowledge that you've gained through life, and that represents the environment. So we categorized all the data according to this. And throughout the whole process, we, the community was the driver, particularly the knowledge holders. We had knowledge holders that participated in our listening sessions, our teach-ins. And as we were writing the proposal, they always challenged us to make sure that we were writing and analyzing within this the worldview, within the data. So there was a lot of information that came through these 12 focus groups. And again, it's a lot of information to distill, but this Diné worldview model really helped us to put all of them into these categories, and also communicate it back to the people in a way that is their own understanding of the world. And so in terms of the Eastern aspect of spiritual wellness, the gold key mine still had negative impacts on ceremonial practices. People felt that it was unsafe to gather natural materials and herbs along the river. And because of that, they felt they had limited access to the river. In addition, as the river was, when it was contaminated and thereafter, people didn't want to go to the river, and so they didn't have access to those materials that they normally do. The focus groups revealed that the participants were uncertain about the future for their youth in terms of the Diné culture, because the river was contaminated and that river is an essential part of their culture. It also impacted that transfer of knowledge to the next generation. As we move towards the South, which is young life, youth, which is focused on economy and livelihood, we focus on the negative impacts to the quality of life and how people normally engage with activities along the river was now disrupted, lost, or diminished. In addition, this area is considered the breadbasket of the Navajo Nation. There are hundreds of farmers that have been farming for many decades who grow all sorts of different types of crops, and they were impacted in their economy and livelihood. They lost revenue and they had financial hardship. In addition, the customers weren't trustful of the crops that they were buying. They were unsure about the safety of the agricultural food sources. And so people started relying on commercially bought food instead of locally grown food. Again, there was long-term harm to, there was a concern of long-term harm to health and how it would impact future generations. Now we move to the West, which is adulthood and represents yellow, family, and community. The gold key mine spill resulted in the Navajo participants being very distrustful of Navajo and federal agencies. They weren't trusting the water testing that was occurring. They also felt that the leadership was not present in the community and unsure who was advocating on their behalf. They felt that there was poor communication about the spill and response efforts by both Navajo and Navajo agencies. And because of all of this, it also began to impact their mental wellness. People stated concerns that they were worried, fearful, depressed, stressed, and that the impacts of historical trauma was being amplified through this environmental catastrophe. Finally, we move towards the North, which is represented in Black, which considers the knowledge of the elders, and in this, it represents the environment. The gold key mine spill resulted in the participants feeling negatively towards the San Juan River. They were unsure about the river and its if it was safe to use and how it had harmed their cultural practices. They were hesitant to have contact with the river, and so they began to use the river less, and so they had less use of traditional plants and herbs. They also stated that the relationship they had with the San Juan River was damaged, as well as with the land. And many people in the focus group stated that they felt like there was a silence in the environment. And again, they were very distrustful about the water quality testing that was occurring. So just to give some specific examples for each of these categories, spiritual wellness, which is the Eastern white direction, some of the things they talked about was the impacts to ceremony. For example, tutadine, which is corn pollen and medicinal herbs that are used in ceremonies, and other types of clay and sandstones. There was concern about impacts to that. And then a decline in Diné traditional knowledge, which included how the youth may not want to resume the Diné agricultural way of life. Into the south of young adulthood is economy and livelihood. And specifically in terms of impacts to the people, they felt like they had to haul more water because they didn't trust the river water. And they were fearful of planting and engaging with the river. The farmers thought that their reputation was tarnished because people were not trustful of their crop. In terms of revenue loss and hardship, individuals had to travel farther to get water, so there was increased transportation costs. And then they felt that because of the impact of the river on youth, they had concerns about genetic changes arising from exposure, and then also increased health risks for the people. Into the West is family and community, and people stated that they don't know who to turn to. They don't trust EPA or NTUA. They felt like there was mixed communication and inconsistent news between the various agencies. And what, in terms of negative impacts to mental wellness, one person stated, because we lived off our livelihood on that water and just being one with the earth, for something like this to happen, it's just stress, depression, sadness, heartache. All of those things takes an emotional effect. You go back in history to the long walk, and all that stuff comes back up. It just opens back up. They, settler colonial government, intentionally did that to us. They do not like us. And finally, the environment. Again, people stated that they were suspicious of the river water, whether they thought it was safe to have any contact with the water. One person stated in terms of their impact to their spiritual relationship was that I look at the river in a different way. It is poison in many ways. I look forward to it, but not now. People stated that they heard, they didn't hear anything along the river that they normally would hear, like birds and wildlife, so they felt it was silence. And they were distrustful of water quality testing, and they wanted to see the data themselves. They wanted to be the data to be transparent and the results to be reported back to them. And they were distrustful of all of that monitoring that was occurring. So all of this information that was collected in the focus group took a lot of bilateral communication, continually communicating back with the chapters on a regular basis, as well as going to the leaders. So we held executive sessions with Russell B. Gay administration and then with Jonathan Nez administration at the end of the project. And so this picture is the executive session held on July 17, 2019, where not only were the elected leaders present, but we had also council delegates, the net grassroots organizations, the Navajo, and the various Diné healer organizations. So we shared our findings, and we had a really rich dialogue with all those who participate to really understand how these concerns could be integrated into existing program development and also better response into the future. I would like to ask my my brother Chile Yazzie to go ahead and conclude the this presentation from his perspectives. Again.
Thank you, Deja, Karletta. And just need to just say that at the time of this great ecological disaster, our people were thrust into a nightmare of trauma that really brought back memories of earlier days when our people were being outright hurt, and different methods of elimination were exercised on us. And there was so much suspicion and distrust of government at that time. There were many visitors that we received from leadership from all over, industrial people, bureaucrats, etc., scientists, and we were inundated with all kinds of reports and information. And out of that fog that our people were in came Dr. Karletta Chief, and to give some semblance of reality and understanding to this great trauma that we were experiencing. So, and as I stated earlier, our communities remain indebted to Karletta for being able to bring into focus and understandable terminology of all of this great event that we went through into perspectives that our traditional elderly people could understand. So with that, we want to go ahead and express our appreciation to all who have been participating in this presentation. Thank you.
We'd love to have a Q&A and answer any questions if there's time. Thank you for this opportunity to present today.
Great, thank you so much for all of that information. It was the whole experience tragic, but we're so lucky that you were there, and Dr. Chief, and able to step in and help the community heal. We have one question, well, actually two questions. One is, where did you receive the funding to do the research that you did or the work that you did? And then I think sort of related to that, have you translated your conclusions into any other, to change in future or similar kinds of situations that have happened, both on Navajo but in other tribal lands? How does your experience, what your outcomes translate to similar kinds of experiences in other tribal lands?
Thank you, Carrie, for those excellent questions. I also want to acknowledge my team. There are many students and faculty that participated. We really wanted to involve the local tribal college. And so we worked with Perry, Charlie, and Don Robinson for many years, where their teacup program were involved in the environmental sampling. And we also had a little summer citizen science where we did farming as life. And so the tribal college students collected soil, corn, and water samples and analyzed that along with the community health representatives. And so we really believe in the community driving the project and being involved in every step of the way. And when this request came from the Navajo EPA, we held the listening sessions, and from that listening session, the research questions were formulated and written up into National Institute of Environmental Health Sciences rapid response grant called the R21. And because of our colleague Jeannie Benali at Shiprock, she was a U of A extension agent there. She's now retired, but she helped with getting resolutions to push that grant forward. And so we were pleased that it was funded within 3 months. And then after that, we were able to apply for University of Arizona Howery Foundation grant, which was also funded about 6 months down the line. And so together with those two fundings, as well as small grants that we received, where our students applied for their own small research grants to fund a student project under the bigger umbrella project, as well as other smaller pots of funding from the centers like the Center for Indigenous Environmental Health Sciences, as well as the Southwest Environmental Institute and the Superfund Research Grant. All of those centers on campus came together to help fund different parts of the project. And this work was critical, it is critical, and will inform risk assessment into the future for governments and other entities who want to understand the ways that the Navajo people and other indigenous people use ecosystem services differently from non-indigenous user, where they don't just use the river for recreational purposes. We found within these focus groups that the Diné people use the river in over 40 different ways that involves cultural and ceremonial, recreational, arts and crafts. And so under those 4 categories, there are many other ways beyond just recreational where there could be other routes of exposure besides just recreational. So I think that is really one of the big take-home messages, is that when an outside entity comes in to do a risk assessment, they really have to know that the indigenous people living in that community use the environment in very different ways. They are very connected and deeply tied to all aspects of the environment. And that is important to know, because the science needs to take that into account, not only in the formulation of the research, but also how the data is collected, analyzed, and disseminated back to the community.
Great, thank you. That's really helpful information, and just, I think, useful for Indigenous people and other researchers all over the world. So thank you very much. We have a few comments in the chat box. One is that someone was asked a day or two ago from a relative whether it was okay to buy steamed corn from Shiprock. And because of the work you've done, they were able to communicate back to them that it's okay to buy corn from farmers in the Northern Agency. So, a clear direct impact of your kind of work on the local community that's ongoing. So that's great. Then there's some other comments. There's one I think sort of related to that is, what is the status of the farming situation now? Are people starting to plant again? Because the Shiprock life has always been based on river water activity. And then it goes on.
I'll have my brother Yazzie answer that question.
Yes, thank you. The farmers were reluctant to farm there for about 2 years. And the third year, we began slowly returning to active farming. And today, there is so much farming that is happening, largely and due to the report that we get from Dr. Chief, as well as the disruption of the food chain due to the COVID. So yes, we are actively farming, and we are very happy to be doing so. Thank you.
Great, thank you. We're actually a little bit over time, so I know there are some other questions, but we'll try to get maybe those answered by email. So thank you again. Thank you both so much for presenting. Thank you for the important work you're doing. And the care and attention that you're giving to our people, the land, water, air, everything. We really appreciate what you're doing, and you have a lot to teach a lot of people. So thank you for sharing that.
AIHEC, and thank you to my co-presenter, my brother Yazzie. AIHEC.
Thank you. Okay, now we're going to turn, as you heard in the Q&A, that Dr. Chief mentioned that they got the initial funding for their project from an I think an R20 or R21 grant from the National Institutes of Health. So we're going to turn now to talk about some federal opportunities that might be available for tribal researchers and other communities to engage in some research and work that is relevant to their communities and to their culture. So first we're going to hear from Dr. Luis Cubano. He is a program director with the Division of Genomic Medicine at the National Human Genome Research Institute, which is NHGRI, which is an institute within the National Institutes of Health. Dr. Cubano's chief responsibility is to lead NHGRI's training and career development program. Prior to joining that institute, Dr. Cubano was a professor and associate dean of research studies at the Universidad Central de Caribe School of Medicine in Puerto Rico. So Dr. Cubano, thank you so much for joining us today. We've heard from you in the past, and you always have a wealth of information to present. So we're looking forward to your presentation.
Can you see my screen?
Yes, we got it.
Good afternoon, everybody. As you heard, I'm Luis Cubano, and I'm the lead extramural training program director for the National Human Genome Research Institute. And today, I want to give you a quick overlook of training, workforce development, and diversity programs at the National Institute of Health. The National Institute of Health is the largest biomedical research agency in the world. And our mission is to seek fundamental knowledge to enhance health, lengthen life, and reduce the burden of illness and disability. One thing that I want to highlight is that there are actually 27 different institutes and centers that compose the National Institutes of Health. So I'm going to barely touch the surface of the funding opportunities that are out there. Every single institute has different mechanisms and they use them differently. So if you have an idea, please make sure that you contact the institute that most closely resemble the topic that you're interested in to receive the best guidance. And at the end of the presentation, there's some reference slides that will help you identify the right person. I want to highlight some websites that will be of interest to you and your students. One is the Careers in Genomics website that lets you know what it's like to be involved in some of the careers in genomics. One that highlights diversity funding opportunities, as there are many funding opportunities out there, and it's easy to get lost in our website. And lastly, a more general website about research training opportunities. And the slides are going to be available to you in the website of the meeting. I want to also highlight some areas that might be easier for you to break in. One of them is genomic data science. We have some opportunities that we're targeting women and researchers from underrepresented populations. We are also having some programs that will allow your institution to use some cloud resources in the development of your research project. That way you don't have to invest in the infrastructure, which can be a costly beginning to any research project. Another area of research that we are interested in is the ethical, legal, and social implications of genomic research. And this website will give you some sample applications that you can look into how to prepare an application. And the great thing about this research area is that it's very broad. So persons from like a low background can do research in ELSI. So you don't have to be a biologist to participate in this. I also want to highlight a opportunity that is called a short course in genomics. This opportunity allows individuals from university, community colleges, even high school and middle school teachers to come in the past when we had COVID to come to Bethesda. The last one was done virtually, and learn about how to integrate genomics into your curriculum. Is also a great way to network and know who to contact for additional help. And by the way, we provide funding for the development of courses and curriculum. So that's something else. So you can come to this course, get the lay of the land, and then come back for an application for the development of those courses. I also want to highlight the Tribal College Consortium on Genomics Training. This actually came out of a group of tribal college and universities faculty members that attended the short course a couple of years ago. And from that meeting, they started this consortium. You can look it up in the web and join it as a way to continue to develop the community and sharing the resources that they're developing. So now I want to go ahead and talk a little bit about research training and career development programs and other funding opportunities, not only at my IC, but at some other ICs in the NIH. The place to look for funding opportunities is this link right here. It is the best one that I have found of the many that we have at the Institute. It's easy to get lost in the many websites that we have. So one thing that you might want to know is like who has the most money for training. Every single IC will have a different training program and different opportunities. The largest budgets for training are in the National Institute of General Medical Sciences, Heart and Lung, National Cancer Institute, and the National Institute of Diabetes and Kidney Diseases. The mechanisms that I want to highlight to you today are the research supplements promote diversity. The good thing about this mechanism is that you don't need to have a grant per se. You need to find somebody that has a grant from NIH, and then they can add you to that grant as a supplement while you develop some preliminary data, and then you can come back to send your grant in. The R15, that is for small institutions that have offer a BS or a BA. The Bridges to the Back is an opportunity for community colleges and provides funding for students while they're doing their 2 years in the community college, and also while they are doing their 4-year degree. The URISE is an opportunity for institutions that offer a bachelor's degree. And then the SCORE mechanism, which provides funding for faculty in 3 different ways. So you can have a lot of versatility there. Finally, I want to highlight also the K-25 mechanism, which provides funding for an individual. They can be with a doctoral degree or somebody that has a master's degree, and they has a background in data science, math, and they want to come and learn some biology. So if you want to do a little bit of a transition, that's a good way to do it. The research supplements, they provide funding from students from high school all the way to the postdoctoral level. So if you have some students near you that they want to get some research experience, this is a good way to get them linked into some labs around the nation. I'm going to go kind of quickly because I want to have times for questions at the end. The R15, as I told you, is for institutions that award the BS. These institutions are going to be ones that make less than $6 million a year from NIH. So you're not going to be competing against huge institutions, because you're going to be competing against people that are in the same pot of, in the same situation as you. So you can target who you're going to be competing against. And every IC, when you write the application, they're going to require that you have some undergraduate students in this application. The Bridges to the Back, as I told you, supports the transition from a 2-year community college to a 4-year institution. It will provide stipend, it provides tuition, and summer research experiences for your student, and some travel money also. The good thing is that the person submitting the application can be at the community college, or you can partner with somebody at the 4-year institution and they can submit the application. The URISE program, once again, is for institutions that make less than 7.5 million from NIH funding. It will provide support for students and help them get into a graduate program. And it's for institutions that offer a bachelor's degree. The SCORE is for faculty members. So if you're a faculty member that just graduated and got your postdoc finished, and you want to get some extra mentoring to get some research data going on, you will go for an SC2. I know that the numbers don't make a lot of sense, but that's the mechanism you want to go for. If you're more experienced, then you go for the SC1, which is a lot more money and time. Finally, if you just want to continue what you're doing, you will apply for an SC3. And the best way is to contact the program officer that is in charge of the program. And if you just look it up in Google, you will find the website and it will take you to it. Also, as I told you, I want to highlight the K-25 mechanism. That mechanism is signed on by many different institutes. In the case of the institute that I work in, we are very interested in getting individuals that have a master's degree in some kind of data science and bring them over to the biology in research that we're doing. And this program has a versatility that it can be for persons with a doctoral degree or persons with a master's degree. I also want to highlight the Genomic Data Science Community Network. This will allow institutions to use a cloud-based system to do research, which will save a lot of startup costs in doing the research. And we're interested in attracting HBCUs, minority service institutions, tribal colleges, and universities to this network. There's 2 other programs that you might want to be aware of. One is called Step Up. That program is by NIDDK. The beauty of this program is that the student doesn't have to leave their home community. They will find a mentor for you in your local area, and that way you can spend the summer doing research close to your home. The Diversity Action Plan is one from my institute, and this one will allow for summer research opportunities. So the student will have to leave the local community and go to one of those sites that we have across the nation. So I want to let you know how to find the person to contact. And that's something called Matchmaker in the NIH website. If you go to NIH Reporter, it will have a link that is called Matchmaker. And when you click there, it will take you to a screen where you will type in what you're interested in. And it will show you the institute and the program officers that work in those programs. That way you can put whatever topic you're interested in, and it will give you a place to start your search. I also want to encourage you to apply to the NIH regional seminars. The next one is scheduled to be virtual, so there will be no cost of hotels or flights. And this is a great place to, once again, learn about the NIH, the different programs that we have, and get to know a program officer that can guide you through the process. If you have never applied to NIH, it's very confusing. I also want to encourage you to develop networks. The Network for Minority Health Research Investigators, they will pay you for your travel to go to your first meeting, and it's a great place to learn about research that is, this is from NIDDK, so it will have to be from internal organs, kidney, diabetes. So if you want to do some diabetes research, this is a great network to get into. And other institutes also have other networks like Heart and Lung. They have the PRIDE network, and the National Cancer Institute also has a network. You can also subscribe to a listserv, and every Friday you will get an email with news from NIH. Every IC also has their newsletters, or you can also subscribe to the Extramural Nexus, which will provide you with information. And this is some of the links that will serve you as a reference on how to find the right FOA and understanding funding opportunities from us. And finally, there are some websites that provide some sample grants, but this is only for that IC. So you can use the general idea, but always contact a program officer from the IC that you're going to be applying to, as they will be able to provide you specific instructions for that IC. And with that, I'm open for questions, or we can do it at the end.
Great, thank you, Dr. Cubano. We are going to hold the questions till the end of this entire session. So we're going to plow forward now, but thank you for that tremendous amount of information. And we will be posting your presentation as well on the NNHRTI.org website for people who would like all those links and all the useful information that you gave us.
Yeah, and if you have any questions, you can send me an email too.
Okay, all right, great. Okay. All right, we're going to move on now to our next presentation. We heard from the NIH, now we're going to hear from the CDC. And this presentation is PHAP, PHAP 101. Does my organization want to host an associate? Delight Sater is going to be presenting. Delight is a tribal member from the Confederated Tribes of the Grand Ronde in Oregon. She is a senior health scientist for the Office of Tribal Affairs and Strategic Alliances within the Center for Disease Control and Prevention's Center of State, Tribal, Local, and Territorial Support. Delight provides counsel to the center's director on issues related to tribal research, science, and program integration, and the implementation of culture and diversity assessments to ensure responsiveness to tribal and stakeholder recommendations. Prior to joining CDC, Delight directed the American Indian Research Program, which she founded in 1998 at UCLA's Center for Health Policy and Research. And Delight has been an important and critical contributor to the whole NNHRT initiative. So thank you, Delight, for all that you've done with us. Joining Delight is JT Theofilos. JT is the team leader for the Partnerships and Education for the Public Health Associates Program. So that's the, remember I said PHAP 101. So now that is the Public Health Associates Program within the Center for State, Tribal, Local, and Territorial Support at CDC. JT leads training and education program development and implementation, as well as partnership and stakeholder engagement activity. JT's experience is diverse across state and non-governmental organizations, from NIH prevention services, healthcare operations, workforce reentry, and acute and post-acute health, the acute and post-acute healthcare continuum. So thank you very much, Delight and JT, for joining us. We look forward to your presentation.
Well, thank you so much, Carrie. And thank you to the Planning Committee for inviting us to share with you one of CDC's training programs. So Luis Cubano spoke a lot about research opportunities, and we are here to share with you one of the CDC's fellowship programs or training programs for those at the post-bac level. And we have a few things to share with you as we visit. We want to talk about, you know, the opportunity for host site sponsorship, but we also would like to share some information with actually becoming a PHAP. Maybe you're interested or know somebody that would be interested in a fellowship program or a training program after their bachelor's degree or master's degree. And so we will be sharing more about that. You know, we want to help you try to make up a little bit of time. So I think I'll just jump right into sharing with you what our office does in partnership with JT's group. We basically help mentor those and support those who end up in tribal host site locations or working with Native communities if they happen to be at a county or a state health department. And we are also helping with some outreach efforts. So you can always contact my office. And we'll have some links at the end of the presentation. I forgot to introduce my tribe. I'm a tribal member of the Confederated Tribes of Grand Round, and JT and I are coming to you today from the Muskogee Creek lands in the greater Atlanta area. Thank you very much, and I'll just turn it over to JT.
Great. Thank you, Delight. Thank you, Carrie, for inviting us and allowing us to participate in this very important meeting. As Delight mentioned, what I'd like to share with you all is a little bit about the Public Health Associate Program, or as we refer to it as PHAP, the Public Health Associate Program. It is guided and geared towards okay, let me back up a little bit. Sorry about that. All right, what we're going to talk about is identifying the mission of PHAP, describing what PHAP is. You'll understand the goals of PHAP and identify at least 3 characteristics of a typical candidate for a host site or to be a candidate of the PHAP host site itself. As Delight mentioned, the program is twofold. It's a 2-year training program. The 2-year training program is geared towards those who are post-baccalaureate or post-master's degree educated from any accredited college or state university across the U.S. So this is an early career public health training program for those individuals interested in public health. They do not have to have any public health experience. They just have to have the desire to work in public health for a 2-year training program that is paid for by CDC. They are employees of the Centers for Disease Control and Prevention, and they are employees of CDC for the 2-year duration of the training program. They are not trained in Atlanta. They are trained in the field. They are trained in the state, at the local health departments, with non-governmental organizations, with academic institutions, with quarantine stations from around the country, Alaska, Hawaii, and the U.S. territories, both in the Atlantic and in the Pacific. So the annual basis is that we have host sites that will potentially apply to host an associate on a regular basis during the beginning of the year, and the program will start in October of every year. The program lasts for 2 years. We will then match associate candidate applications with host site applications for the 2-year duration. Okay. The mission of the public health, let me do this. I'm sorry about that. Let me go back a little bit. The mission of the Public Health Associate Program is to train and provide experiential learning for public health associates or early career public health professionals that are housed and maintaining the 2-year work assignment at a local host department. The actual mission is that we provide early career public health professionals the opportunity to work at field-based experiences, the opportunity for them to actually integrate into a field-based assignment, to integrate into the culture, the environment, to experience a different opportunity of living than where they are living in currently. The actual opportunity is based on the needs of a host site. The needs of the host site are dictated solely by the host site. So if your host organization is potentially working on COVID response or chronic disease prevention or public health preparedness activities or environmental health support activities, then the work activities that are proposed by the host organization would be surrounded and would be encompassing those work activities that would be appropriate for an early career public health professional to be doing at your host site during the 2 years of their work experience. Some of these associates have little to no public health experience, but they're intelligent individuals. They have to have at least a 3.0 grade point average for the duration of their undergraduate or graduate work and be no more than 2 years out of their most recent degree. So these folks are truly new to the workforce. Some of them may have had little to no professional work experience other than jobs over the summer of college or in high school, but this might be their first public health experience and work in the professional environment. It's a 2-year assignment in one primary focus area, in one subject area. So they cannot be working in preparedness and environmental health and X, Y, and Z, but they've got to be focused in one primary focus area for the duration of the 2 years. As I mentioned earlier, they're federal government employees, so the CDC will pay for their salary and benefits for the 2-year work assignment at your host site. This is truly a partnership between CDC and our state, our tribal, our local, and territorial health departments who actually host the associates, the non-governmental organizations who host the associate. It is a true partnership that we will actually maintain for the duration of the 2 years. The benefit of actually hosting an associate is that the host organization will get potentially an employee for 2 years with minimal to no cost out of their pockets to get the work done associated with the 2-year work assignment. Okay. The competency program is based on these 9 domains of competencies. The work assignments should be focused on these areas of public health that will help the associate build professionalism, communication, awareness of cultural competency and cultural humility, the dimensions of public health, financial planning and management. These are areas that the host assignment should provide the opportunities of the associate to actually meet the competencies in these domains. Okay. PHAP is not an internship program. It is not a source of administrative support. It is not a federal government employment service. It is truly providing a program that provides support to the host organization with CDC early career professionals. This is not a CDC subject matter expert that is placed at a host organization. This is an early career public health professional who is expected to do the work associated with the work assignment for the 2-year duration of the program. Okay. PHAP this goes to show you a little bit of the actual duration of the over duration, the number of applicants that we get. Right now we're seeking tribal related individuals who are of the American Indian or Alaska Native background to apply to PHAP. The application period will be in January of 2021. Through the website, individuals who are interested in applying to PHAP will be encouraged to submit an early application in January of 2021. The minimum degree is a bachelor's degree. They've got to have a 3.0 grade point, but if they're individuals of the American Indian, Alaska Native background who have an interest in public health, this is a great opportunity to partner with CDC, provide services to an organization. Ideally, we would like to place them in a tribe or tribal related assignment that is near their home, where they can actually work and provide services to the entity in which they're matched with, which can then develop potentially a long-term capacity building opportunity to have the associate after the 2-year training program potentially stay at that tribe or tribal related assignment. Okay. Let me skip past a couple of these slides. Let me talk a little bit about the value added to the host site. This is supporting the host site's efforts to meet your program goals. If you've got a lack of staffing or you've got a gap in your workforce development or your workforce capacity engagement efforts, this is a great opportunity to employ a CDC federal government employee on behalf of CDC, but does the work of the program. So in a supporting effort, they can support capacity building activities such as assisting with preparation of a public health accreditation process, supporting water sampling collections activities with environmental health and so forth. But this truly is an opportunity to help build internal capacity of your host organization. This truly advances the public health initiatives as well. Okay. Again, the minimum application criteria has to be a bachelor's degree from an accredited college or university, a 3.0 grade point average, and graduated within the last 2 years of the actual application period. They also have to be a U.S. citizen or permanent resident. Okay. These are the characteristics of the associate that we seek. They've got to be a big picture thinker. They've got to be an effective communicator. They've got to be socially and culturally inclusive. They've got to thrive in a dynamic environment. Public health changes frequently. They've got to demonstrate flexibility. They've got to be intelligent and be a hands-on learner. These are the characteristics of a basic associate, but those from the American Indian, Alaska Native background, we encourage to apply. We encourage them to apply. This is a great opportunity to get a 2-year paid training experience for the associate moving forward. Okay. This goes over the disposition of our PHAP graduates. It just tells us that the majority of PHAP graduates will actually stay in public health or in healthcare beyond the 2-year training program. Okay. The rest I'll defer to the materials that we'll share with the individuals here on the call. I will open it up for questions when the time is appropriate, Carrie, and turn it back to you at this point. Thank you for the opportunity.
Great, thank all of you. That's a lot of information very quickly provided. So thank you for sharing all of this with us. We do have some questions. And the first one, really easy for both Luis and Delight and JT is how competitive are the NIH grants and the NIH grants that Dr. Cubano went over, and then also how competitive is the CDC PHAP program? In other words, if a student applies, how likely are they to get accepted?
I'll defer to Dr. Cubano first.
So the diversity supplements, most institutes will go out of their way to fund those applicants, especially if they're students. So as long as you meet the deadlines and you have a detailed training plan, they will try to fund them. So most of them will get funded. So that's definitely a way to get into the system. The other mechanisms, it really depends on what mechanism you're using and what institute you're going after. So that's why it's very important that you contact a program officer and they will guide you and they will let you know, this is like the best time of the year to come, or this is like the right mechanism to use, or don't come to my IC, go to this other IC where they're more likely to fund that type of science. Or just by having a few words that you change in your abstract, you can like send your application to the wrong place. So it's very important that you contact somebody before. You don't want to spend 6 months writing an application to send it in to get it sent to the wrong place.
The PHAP program is a fairly competitive application pool. We have a number of host sites that apply to be host organizations for the 2-year duration. We have a number of candidates that will apply as well on an annual basis. What our initiative is to hire and recruit additional American Indian Alaska Native candidates. So we would encourage anyone who has an individual who has a minimum of a bachelor's degree and a 3.0 in their most recent degree within 2 years of graduating, encourage them to apply to PHAP. The competitiveness will depend on a number of variables, but we would encourage anyone who has an interest in public health programming or being trained and getting paid for 2 years of field-based experience, highly encourage them to apply to be a candidate in the PHAP program.
I have a follow-up to that, Carrie.
Mm-hmm.
The PHAP program is actually a part of the umbrella programs in federal government called Pathways. And so it does allow for hiring straight out of PHAP into federal positions. And, if people are interested in that as a mechanism for a long-term career in the Fed, what a wonderful opportunity. And I'm sure some of those at NIH have the same process. So those kind of detailed questions, or if folks want more along those lines, they should reach out to JT or myself, and we'll be happy to talk more about that, or give a follow-up, presentation to a university or whatever with more detail.
Great, thank you. Very interesting. I have never heard of this program, so I think there's a lot of interest in it. One, which is sort of similar to a question for NIH, is I think from a student, is there anything a student should be doing while they're still in school to make themselves more competitive for the PHAP, to be selected as a PHAP? For example, doing summer internship programs or something like that. And then somewhat related to that was a question for Luis about what is NIH doing right now for the career pipeline, the early career pipeline, beginning with high school, because there have been a number of programs at NIH, and maybe CDC have sponsored over the years for beginning at the high school, middle school level to encourage people to, or students, young people to go into health careers. So how are you dealing with those kinds of things in this COVID-19 time?
Carrie, let me address the preparation for PHAP as a candidate first, if I may. The program is called Pathways for Recent Graduates. As Delight mentioned, it is a pathway from the private sector to the public sector and to maintain a position with the federal government converting non-competitively after the program. So they don't have to reapply. The program is for early career public health professionals. The less experience that somebody has, the more qualified they will be for this program, believe it or not. So we don't expect anyone to have any real public health experience. The things that they've got to do is they've got to study and get a 3.0 in their undergraduate or their master's degree program and be within 2 years of graduating from their most recent degree. That will get their foot in the door. Okay, there's nothing to prepare. There's nothing to actually get more experience. They've got to have the desire to work in public health. But this is what the nice thing about PHAP is. It's geared towards those who have little to no public health experience. So more experience would be more detrimental to their application to PHAP, believe it or not.
We have plenty of other programs that are for more experienced, but we're not presenting on those today.
Yes,
There's
yes.
about 40 programs, training programs at CDC.
Wow.
Maybe we can cover those at a future time or share more information.
Wow.
Reach out to us. Yeah. And COVID definitely impacted those. Our minority programs this past summer, immediate summer, were canceled. Our Ferguson Fellow program with Johns Hopkins University also, canceled. It's had a huge impact.
Mm-hmm.
A lot of our summer programs, we went virtual. So the ones that were less affected was the one that did with data science. So what they did is they send data sets to the students so they could work them at their home computers. And that way we could still pay the stipends to the students and keep them engaged using webinars to do like seminars and everything else. So we are trying to adapt to this new reality using technology as most as we can.
Great. Well, that's good to know. I know a number of the tribal colleges, we actually had a number of other partnerships for summer internship programs. And we transitioned a lot of them to online, and they were surprisingly successful. The students really adapted and stayed in their local community, and those using those big data sets and things I think are very useful in the cloud, as you mentioned. I'm trying to see, Maggie, are we out of time, or do we have time for a few more questions?
We are back on time, so depending on how we feel with that, we could maybe spend another minute or two for questions.
Okay. All right, I'll ask one more question really quickly, which might be something that JT skipped over, but can tribes apply to be host sites? And is there training for organizations to meet the competencies that you outlined?
Absolutely, Carrie, absolutely. Tribes are very eligible. Any organization is eligible to apply to host an associate as long as they can provide an opportunity for the associate to meet the competencies of the program. So if you look at those 9 domains that we had outlined, if an organization can develop work activities that can give the associate opportunities to meet the competencies, they are more than welcome and encouraged to apply. We partner with many tribes and tribal related assignments, tribal epicenter organizations. We've got some placed in the Navajo Nation in Shiprock, Arizona, that have been successfully matched and organized to help the EPI efforts in Shiprock, Arizona with the Navajo Nation. So they are highly encouraged to apply to host an associate.
Okay.
We have PHAPs who are native and non-native serving in tribal and native serving organizations. So and also county or state positions that have a priority responsibility towards tribal communities. So there are a lot of opportunities there. You can also partner. You can be a county health department that partners with the tribe and, comes up with a pretty cool project that's collaborative for the PHAP to work on. Just all kinds of great things.
Okay. All right, great. Well, thank you. Thank you all, the 3 of you, for this excellent and informative panel. I think everyone learned a lot, and you shared some very important and useful information. So we will definitely be following up. So thank you very much.
Our pleasure. Thank you for the invitation again, Carrie.
Thank you. So now we're going to turn to our last session, which is really focused on mentoring and research, another important research topic. And the title of this session is Wastewater-Based Epidemiology in Tribal Communities. So we're really looking forward to this extremely timely presentation, especially for just here in the Washington, D.C. area. We have this issue going on now, not in our general community. So this is something that is important, I think, and could happen at any time to any community. So we're pleased to have Dr. Otakaye, or Otak Conroy Ben, who is Oglala Lakota, and an assistant professor in the School of Sustainable Engineering and the Built Environment at Arizona State University, where she is an advisor also to the Arizona State University chapter of ACES. Prior to these roles, Dr. Conroy Ben was a project engineer with the county sanitation districts in Los Angeles County, where she studied odor control and wastewater treatment systems. Dr. Conroy Ben's research focuses on the biological effects of polluted water. Her research interests include analytical and environmental chemistry, environmental endocrine disruption, metal and antibiotic resistance in bacteria, wastewater epidemiology, and water and wastewater treatment and reuse. So we're very pleased to have you here, Dr. Conroy Ben. Thank you very much for presenting, and we look forward to your session this afternoon.
Okay, thank you, Carrie, for the introduction. Can everyone hear me, and can you see my screen? Great.
Yeah.
Okay, so in the introduction, as Carrie stated, my name is Otakuye Conroy Ben. My Lakota name is Titakuye Otawi, and I come from the Pine Ridge Indian Reservation. The research I want to present to you today comes from Arizona State University's Ira A. Fulton Schools of Engineering, and my colleagues are listed here, but I'll give them their due thanks at the end of the presentation. So I want to start this talk with background on wastewater treatment. I'm a wastewater engineer of 20 years. And if you think of the wastewater treatment system, anything we dump down the drain or anything we excrete in our waste goes into a sewer pipe collection system where it then heads to the wastewater treatment facility. And in this facility, we're looking at removing through various processes bulk organics as well as suspended solids, which can include microbes. And there are various processes. We're going to treat the water stream, and then we also have processes to treat for solids that may come through the system. So in my research, I tend to focus on this area where we're looking at the removal of wastewater indicators or organic pollutants. There's no federal legislation to treat these organic micropollutants like those shown here. And while most of these are removed during the wastewater treatment process, many of these are not completely removed, and they'll just get discarded into the environment where it is. So these are wastewater indicators. I'm showing mainly organic pollutants such as the Teflon coating, any drugs of abuse that may be excreted in our waste, just natural and human hormones. Can lead to multi-drug resistant bacteria in the treatment plant and environment, nano and microparticles, the bisphenols, as well as pathogens and their antibiotic resistant genes. So these are found on the effluent side of wastewater treatment facilities. And an NPDES, a permit is required to discharge wastewater to the effluent, to the environment. This is allowed by EPA, where we and it'll be discharged either to rivers, to coastal communities, or if the effluent is treated to a high standard, that can be reused. So there is a federal registry that contains all of these NPDE permits, which gives information on flow rates, locations, as well as treatment. But the focus of this talk is on the influence side of wastewater treatment, where with advanced analytical techniques, we can measure discarded and excreted waste and measure these as indicators of human health. And this is part of the emerging field of wastewater-based epidemiology, where excreted waste is collected in that sewer system, and then it goes to pipe. And at point, that's where we want the sample before it actually reaches the wastewater treatment facility. We can then store the sample and then prepare it for whatever type of analysis that we may be interested in. So in this sewer line, 1% of the volume of wastewater is urine, and analytical chemistry has really advanced, and so we can measure nanogram per liter, or 5 virus particles present in a volume of sample. Wastewater-based epidemiology has been traditionally used to measure drugs of abuse in major areas, Europe, these, and now it's becoming very relevant because we're finding that we can also use waste epidemiology for pathogens, including coronavirus, as well as the gut microbiome. So we collect a volume of untreated wastewater sample. It's shipped to Arizona State University, and then it is processed. We'll extract the organic pollutants from the wastewater sample and process them on an instrument called chromatography tandem mass spectrometry. That information will give us the original concentration in the sample. And then we also need to know how many people are contributing to the sewer flow. If we get a wastewater sample where we're measuring 1,000 people, it's going to give us very different mass flux rates compared to a city that's contributing waste from maybe 100,000 people. So we also need to know the flow rate of the sewer system. And then there are also some calculations that look at metabolites, time of transport, and then these values can be calculated back to consumption per person per day. So here are some relevant studies. Locally, my collaborator, Dr. Rolf Holden, is looking at drug trends in Tempe. This has been used to track methamphetamines in the rural Northwest, in major European cities, and in the upper right-hand corner is a study I conducted several years ago in Salt Lake County, where we looked at drugs of abuse in these 7 major metropolitan areas of Salt Lake County. This is one of the products coming out of waste epidemiology. So the Halden lab, which does process my samples, they're measuring opioid use in Tempe. So this center panel is the sewer shed of the town of Tempe. So these are broken down by areas, and this is where the sewer pipe network is before it enters a major wastewater treatment plant. So his group they have a collaboration with the city of Tempe. They have been monitoring fentanyl, oxycodone, codeine, as well as heroin in all of these areas. And I believe they collect samples every week, possibly every month. But you can, I can provide this website to you later if you like. You can just click on an area and it will tell you the drug use trends for that area. So this is a very nice tool to monitor community health. So I wanted to ask, is wastewater-based epidemiology applicable in tribal communities? So we first need to evaluate the tribal sewer infrastructure. These remote areas can have a limited sewer infrastructure, or it can be very complex. So we need a centralized collection system that can include pipes, lift stations, maybe even a full centralized treatment plant. In any case, we need accessible sewer flow. And we also need to ask if we can collect these sewer samples, is it representative of the community? This is one of the sample sites that we have analyzed, where we would lower a sampling device into the manhole to collect sewer flow. There are some advantages to using wastewater-based epidemiology in tribal communities. One is that this type of analysis provides anonymity. You know, we're measuring from a community, but we're not requiring individuals to provide biospecimen testing, which can be prohibited by tribal governments. These are near real-time analytical techniques, okay, meaning we can go in, we'll sample for 24 hours, and we'll tell you that snapshot, you know, within a week. We can get improved spatial and temporal resolution of, say, a drug study. Imagine if we have a reservation where they survey tribal community members about substance abuse. You know, those aren't always reliable pieces of data. The entire population is not surveyed. With wastewater-based epidemiology, we have improved spatial and temporal resolution. Once we have data, we give that back to the tribe where they can focus on targeted education and diversion programs. And this can be used to complement existing surveillance, so individual drug tests as well as surveys. There are some disadvantages. We are taking a sample from a large community, and those results will, you know, be reflective of that community and be generalized and possibly used to stigmatize that community. So we have to be aware of any sensitive information that can be released from this type of study. With respect to drugs, monitoring can be cost prohibitive. We're using very expensive analytical equipment. If you were to take a wastewater sample, just send it out to a commercial lab to analyze all of these chemicals I'm about to show you, it can cost upwards of $1,000 per sample. We also need to know about the population contribution to the sewer shed, and that data may not be available. So under an NSF funded project, my team is looking at tribal wastewater infrastructure to see if we can use wastewater-based epidemiology in basically any tribe. So tribal wastewater infrastructure is very unique. When we scanned all the NPDES permits, we found that there are 95 tribes out of the 560 to 70 so with NPDES permits. We looked at two different databases, the FRS and ICIS. We get information on sewer flow, and there's about 250 million gallons per day of sewer flow in Indian country. And then if we calculate the sewer contribution per capita, by design, this collects from about 2.8 million individuals. The maps on the left show you where these sewer facilities are within Indian country. There's a lot, obviously, where we have a lot of land-based reservations. What we found is that wastewater treatment is non-existent in extremely rural communities. They're either using outhouses or septic systems. And then we're at the other extreme for more advanced wastewater treatment, such as tertiary treatment, which is not required by EPA, but can be used if the tribe wants to reuse their wastewater. You'll see some terms on here, POTW. This is a publicly owned treatment work, and that means it's just owned by a public agency, maybe a town or tribal community. We also found that tribal casinos are listed in this database. So this is effluent coming from people who would visit a casino, which I think in and of itself is an interesting study to see what outsiders are bringing into the reservation. The BIA operates their own set of lagoons that service BIA schools, and those are listed as federal wastewater treatment facilities. The map on the lower left just breaks down these facilities by sewer flow rate. So this also gives an idea of the tribal population contributing to the sewer shed. So we have been working with tribal communities in wastewater-based epidemiology for about 5 years now, and we've kind of developed this approach for working with tribal communities in this type of research. We first meet with different entities within the tribe. We meet with the health director as well as the utility, and then if the tribe also has an environmental office, we'll meet with them. And it's really important that we work with all of these different groups because we need approvals to sample, but we also need to make sure that data gets back to the appropriate offices. So once we've met with people, we also get tribal approval to conduct research. And then we seek out funding, and our projects go through the ASU Tribal Research Review. Once we get funding, we'll coordinate sampling with the tribal utility, and then we'll analyze those samples and then return results back to the tribe. When it comes to sampling, we are dealing with wastewater. I've been working with wastewater for 20 years. I've gotten sick from just handling wastewater, so you have to be aware of some precautions when working with raw sewage. Raw sewage contains human and animal pathogens. It's highly requested, and in fact, it's mandatory at ASU that you get immunizations for hepatitis and typhoid. You need PPE, so you don't get splashed by this untreated raw sewage. And in the case of maybe collecting a sample from a very deep manhole, you may need training in confined spaces. This here on the right shows a composite autosampler. So this will pull a specified volume of wastewater at certain time increments. And we want to target a 24-hour composite sample so we get a full day's contribution to the sewer shed. Down on the lower right is an example of a lift station. Lift stations are where many of the sewer lines come in and collect, and they pump the sewage to a treatment facility. So I now want to move to an area that I'm researching, which is substance abuse in tribal communities. My collaborator, the Halden Lab, they have the ability to measure hundreds of chemicals, and this is a list that we have been approved for by some tribal communities to analyze for in the sewer shed, including over-the-counter drugs, recreational drugs, prescription drugs, opioid, withdrawal medication, opioids, and illicit substances. So you can see there's a wide range of substances that can be used, and that also can be misused and abused. So you'll see the main drug like cocaine, by the time it passes through the human body, it becomes a different substance. So we're not only measuring the parent drug, but we're also measuring the human analyte to see if it truly was used or if it was just maybe dumped down the drain. We would get very different chemical signatures from the different drugs. So we took this methodology to 6 different tribal communities. The tribal communities have asked to remain anonymous, and we're respecting that, but we have been given permission to present data. So what we found was that wastewater-based epidemiology is a novel tool to measure substance abuse and misuse in tribal communities. We were basically able to detect nearly all of the drugs and their analytes within these 6 different tribal communities. What was shocking was fentanyl was found. We also found a lot of the opioids, The opioid treatment medications were also found, but at much lower concentrations than non-tribal communities. So that kind of tells us that maybe some of these communities are not getting the treatment, or I guess the people are not getting the treatment that they should from opioid alternatives. We also found, illicit substances like caffeine and alcohol at all of our sites. But what it comes down to is that in tribal communities, substance abuse varies. Regionally, some tribe in one state may be using one substance, where in another state it's a completely different substance. So there's a lot of variability within these results. And so that brings us to what else can we use wastewater-based epidemiology for to benefit tribal health? And so that brings us to my most recent project, where we're looking at coronavirus in tribal communities. And the reason we can do that is because SARS-CoV-2, the virus that causes COVID-19, is shed in urine and stool. So in this NSF-funded project, we have already determined which tribal communities can utilize wastewater-based epidemiology. And then we're also going to quantify SARS-CoV-2 in tribal wastewater using qPCR. We're also going to develop training materials for tribal wastewater operators, as well as health administrators, on how they can most efficiently use this data. We have partnerships with Indian Health Service, different tribal research boards, tribal wastewater and water divisions, and we also need approvals through the tribal research, ASC Tribal Review Board, as well as biosafety, since we are, again, dealing with human pathogens. As of last week, the table on the right shows the coronavirus positive testing rate that was released by the Indian Health Service, and these are the IHS service areas. You can see that the positivity rate varies. It's been in the news that Alaska is showing very low levels of coronavirus. But if you look at the Phoenix area Indian Health Service, which serves many, many different tribes, this is showing the highest positivity rate across tribal communities. And so we want to focus on this area and include other areas when it comes to this type of analysis. And so how can these results be used effectively? This is the Tempe COVID dashboard supplied by my collaborator, Dr. Halden. These are publicly available. He started measuring coronavirus in the Tempe sewer shed back in March. And then we went into lockdown, before lockdown, where they were only collecting from a few sites. They started to see spikes in coronavirus in the sewer shed. And then we went into lockdown, and the coronavirus levels became non-detectable. Arizona eased their restrictions at the beginning of June, and as a result, we started to see more coronavirus in the sewer shed. If you take a look at the graph on the left, if you focus in on this community called Guadalupe, they are basically a cove of Tempe proper. And Guadalupe is where one of the Pascua Yaqui tribal offices is headquartered at. And so their sewer line with Tempe, and so we were able to isolate that. And so what was shown is that at the beginning of the coronavirus pandemic, there were non-detectable levels. And then even during lockdown, the levels of coronavirus approached 1 million moles per liter, and that was astronomical. And restrictions were eased in June, and there was still really no, decrease of coronavirus in the sewer shed. And these results were shared with the Pascua Yaqui community, and this was just published a week and a half ago, that as a result of the findings from wastewater-based epidemiology, they were able to address these findings, and they moved to more aggressive actions at containing COVID-19. And so these are my collaborators here, but if your community is interested in looking at coronavirus in the sewer shed, please contact. I encourage you to share with your tribal directors as well as wastewaters. Or if you are a tribal director yourself, please go ahead and discuss with me directly. But back to my acknowledgements, all of my collaborators are listed here. The Biodesign Institute, One Health, the tribal partners, the Intertribal Council of Arizona, as well as my funding. Sorry, I have to sneeze. Excuse me. And that is the end of my talk. I guess I will switch it back over to Maggie, who can handle the questions for this as well as for previous presentations.
Great, Oktay, thank you very much for that informative presentation. I learned a lot, so I'm sure other people did as well. We do have some questions, and it's really fascinating. And well, first of all, let me just congratulate you or thank you for your commitment to doing this kind of work, this research, and for your commitment to all tribal communities. We're all benefiting from that. So thank you very much.
Thank you.
So one basic question, can people contract COVID-19 from wastewater?
So early research is showing that from the effluent, you cannot, because water will go through a disinfection process. At the untreated stage, though, the wastewater community is still doing that research. It is entirely possible that these can get aerosolized and be transmitted in that manner. But we have also seen that the coronavirus genetic material is very unstable in warm environments through sewage transport. The virus can become inactivated.
Great, thank you. Somewhat related to that, back when you were talking about the drugs in the water, and maybe this applies to the COVID, which I think you just answered, but are the drug remnants removed in the cleaning process of the wastewater?
Yeah, so that's the area that I like to focus on is wastewater treatment. And some drugs are removed pretty well. But there's a class of drugs that are not removed and they are getting back out into the environment. It is like cocaine. We're finding that in wastewater effluent.
Oh, okay. All right. There was a question somewhat related to that. And I guess we're actually a little bit over time, so maybe I'll just ask this one last question. Is there an impact of the drug particles that do get transferred into the environment? How is the wastewater used? Is it put back into the environment?
Yeah, so I'm also looking at a community that discharges their wastewater into a stream that's used for cultural use. So we have been able to detect drugs in that stream, but keep in mind these are very, very low concentrations that are not pharmaceutically active, but they are still present.
Yeah, really, really fascinating. Okay, can I ask one more question, or do we have time?
That's fine. Yeah.
Okay, just one really quick question. Do you know how many tribes are doing this type of research, like nationally? Is it?
I would say not many, because health directors as well as wastewater managers, they don't really know that this is can be applied to human health. So right now I'm just trying the word out there that to monitor health, and hopefully meds will come on board.
Oh, great. Really interesting. Thank you very much for your presentation. It's really, really informative. So we very much appreciate it, and especially for you taking the time to be with us today.
Okay, thank you.
Great. Okay, so now I just want to thank everyone for hanging in with us, and I'm going to hand it over to Maggie, who's going to close. We have an online evaluation, which will just take a few minutes that she's going to share with us.
Hi, so thank you all for attending today. Just as a reminder, so we're actually going to do something a little different today. We're going to do our evaluation right now. So I will bring that up in just a moment. For people who maybe aren't able to take it right now, maybe they're on their phones, we are going to post it on the website. Additionally, we'll have all of our presenters' materials posted on the website, and we are recording this session, and we will have it up hopefully within about a week or so. So I'm going to go ahead and pull this up. Hopefully you all can see that now. So if you want to just take a few minutes to go through this evaluation, and we'll give you about maybe 2 minutes to get through that. And thank you in advance for doing this. And I do want to note, thank you to those who are completing this. I do want to note, we don't actually have on this evaluation an area where you can post any additional comments you might have about your experience today. Please feel free to send any emails to me with those comments. Again, it's Maggie, or it's M Grandin, MGRANDON@gmail or at AIHEC.org. You can also find that email on the NNHRT website. So we'll give it just about 1 more minute. It looks like we've had about 75% of people turn in results.
Great, and thank you all for taking the time to do this. And also, just as a reminder, we hope that you will join us next month, the 3rd Wednesday in October, if you can believe it's already October, and then also in November for our ongoing series. Thank you very much for being here. Thank you, Maggie.
All right, I'm going to end the poll. It looks like we got everyone respond. We got everyone's response. So again, thank you all for joining, and hopefully we will see you again next week. And thank you to all of our presenters.
Thank you.